This is the pelvic ultrasound of a 26 years old female unmarried with the history of dysmenorrhea. What we are seeing is the uterus, a longitudinal section, aligning the uterus to the vagina. The uterus measures 10.6 centimeters in length, which is normal, 6.1 centimeters in anterior-posterior diameter, which is much less than acceptable normal, because the normal is 5.0 centimeters, and the patient has the anterior-posterior diameter of 6.1 centimeters. Longitudinal section. Now the transverse section. This is the transverse section of the uterus, and in transverse section the measurement is 7.2, which should not exceed 5 centimeters. This is the anterior wall, this is the posterior wall, and in the center what you are seeing is the endometrial canal. The endometrial canal measures 3.7 centimeters into 4.5 centimeters, and it should not exceed more than 14. Moreover, you can see that the mixed echo thick material is seen within the dilated endometrial canal. Just focus on the endometrial canal at present and don't see any other orbit, any other region. Now, the length wise, the endometrial canal is dilated up to 6.1 centimeters. In anterior posterior diameter 3.8, and in this dimension 4.3 centimeters. This is a significantly raised, enlarged diameter. Now, this is the anterior wall of the uterus, the anterior myometrium, the fundus of the uterus, the posterior wall in longitudinal section, and this is the uterus in transverse section, anterior wall, posterior wall. This is the longitudinal section, this is the transverse section. Okay, now after going through this, the measurements, you can see that there is a significant amount of fluid collection in the pelvic cavity. This is fluid. Okay. And this is the urinary bladder. This black area that you are seeing is the urinary bladder in longitudinal section. Another thing to note is that the myometrium is normal. The myometrial thickness is normal. There is no focal lesion relating to the myometrium, posterior, fundal, and anterior. Now, proceeding a bit further, let's see the myometrium in total. This is the cervix. The lower part is the cervix. This area is the cervix, this is the cervical canal. This area is normal. बेटा होगा कि आपको पेशाब जल्दी आ जाएगा। इंजेक्शन लगाओ। Now the anterior segment myometrium measures 16 millimeters and the posterior segment myometrium measures 14 millimeters, which is normal. So we do not see any fibroid or any other lesion relating to the uterus. So the main pathology relating to the uterus is in the endometrial canal, which is full of different strength internal echoes and is dilated significantly. With fluid in the pelvic cavity. This is fluid. This is all fluid with echoes. And in the region of the left adnexa, we do see a cystic area there. This cystic area that you are seeing is in the region of the left adnexa, and then this cystic area communicates with the fluid. So in fact this is pocket of fluid that communicates with the free fluid below the posterior, below the uterus. Now this is the free fluid with echoes. This is the transverse section. This is the endometrial canal. This, note the amount of fluid. Significant amount of fluid is seen posterior to the uterus, and this fluid then becomes a part of cystic loculated pocket of fluid. Here it is. So this is the fluid with echoes in the pelvic cavity. Now this fluid in transverse section, when I maneuver the probe 90 degree and the uterus becomes longitudinal, you see that it is continuous with a pocket. This is a small pocket of fluid which measures 8.2 centimeters by 4.5 centimeters by 6.5 centimeters. This is the uterus in transverse section. Myometrium is fine. This is the uterus in longitudinal section. This area. This is fluid pocket. This is the urinary bladder. Again, this is the urinary bladder. The endometrial canal. Without any investigations provided to you, what will you describe this finding as? Well, the approximate volume of this fluid, approximate, it's not exact, but we can have an approximate volume, is more than 130 cc, 130 mLs. Decrease the zoom. This is the normal. जब पेशाब नहीं रोका जाएगा तो मुझे बता देना. this is the now the right ovary is not clearly differentiated, trying to do so. So this fluid and this pocket of fluid can well represent rupture of a cyst, left adnexal, that will be and here you can see the right ovary is at the edge of the fluid pocket on the right side, measuring 5.2 into 2.5 centimeter. This is the, I think I have exceeded the dimensions, 4.3 into 2.1. And this is the right ovary. It is pushed at the lateral end of the fluid pocket. Now the second possibility is endometrioma. Third will be endometrial fibroid, because the appearance of the endometrial canal is very much in favor of internal adenomyosis or fibroid, because at the age of 26 years with dysmenorrhea do favor this finding of internal endometriosis. So two possibilities regarding the uterus. One, this dilated endometrial canal filled with different strength internal echoes, thick echoes with internal cystic areas, tiny cystic areas. And the second will be a fibroid in the endometrial canal. Regarding this pathology relating to the right adnexa, with left ovary not being clearly realized, so this can be a ruptured ovarian cyst with fluid collection in the loculated. The fluid is loculated and there is fluid collection in the pelvic cavity. This is the fluid. This is the urine. This is the urinary bladder. This is the uterus. This is the endometrial canal. And this is the fluid pocket, posterior to the uterus, extending into the region of the left adenexa, from posterior to the uterus into the region of the left adenexa, with echoes in it. So this is our case of the day. Do comment, do suggest any other possibility of finding. So this is, we are done with this ultrasound.